Distinguished guests, colleagues, ladies and gentlemen, good afternoon to you all, and thank you for making the time to attend this regional workshop where we will be formulating the roadmap for AMR success in pharmacy. My name is Sabiha Isaac. I'm the chairperson of the Global Respiratory Infection Partnership and the South African Research Chair in Antibiotic Resistance and One Health at the University of KwaZulu-Natal in Durban, South Africa. Welcome to this regional workshop to develop the roadmap for AMR action by pharmacy for the Southeast Asia region. I'm very honored to share this platform with Dr. Veera Thangrad and Manjari Garat from the Southeast Asia region. A few words about my co-facilitators. Dr. Veera Thangrad is a pharmacist and lecturer at the Faculty of Pharmaceutical Sciences at the Hua Chiao Chalamprakit University. In recent years, Dr. Thangrad partnered with the university to develop the sore throat application, a self-diagnostic tool to encourage patients to assess and diagnose upper respiratory tract infections before requesting antibiotics. Manjari Garat is the newly elected Vice President of FIP, as in this week, and we extend sincere congratulations to her, and served as the Vice President of the Community Pharmacy section of FIP, as well as Vice President of the Indian Pharmaceutical Association and the Chairperson of its Community Pharmacy Division. Manjari has been actively involved in the professional development of pharmacists through training and good pharmacy practice. FIP recognized Manjari as a fellow FIP in 2016 for her services to community pharmacy and pharmacy profession. So I will begin with a brief overview of the workshop objectives. Dr. Thangrad and Manjari will then facilitate an interactive session to develop the roadmap for AMR action by pharmacy in the Southeast Asia. And I will end the workshop with overview of the session and next steps. Just to state that this workshop builds on the workshop that we held on the 12th of September on Saturday last week, which was a global workshop, the recording of which and associated podcasts of which are available on the FIP website. The objectives of the regional workshop is to work together to drive regional initiatives in antimicrobial resistance by translating policy into action. During this workshop, we will co-develop and make a commitment to a regional roadmap for AMR success in pharmacy. GRIP is honored to partner with the International Pharmacy Federation to drive AMR action in a new decade by pharmacy. So we ask the question, why pharmacists? To answer this, I want to draw on the Pentagonal framework of the Global Respiratory Infection Partnership. This framework speaks to the role of policy, prescribers, pharmacists, and patients in the prevention of antimicrobial resistance. So let's begin with policy. Policy is endorsed, the framework speaks to policy endorsed by local governments and clinical communities of practice that advance antibiotic stewardship and conservation. It also speaks to patient empowerment and education about appropriate antibiotic use and symptomatic treatment options. It includes pharmacy guidance on their stewardship role as educators, providing patients with advice and support on infection management and when to consult a doctor. It also includes prescriber guidance on antibiotic stewardship and effective dialogue with patients. And finally, it focuses on prevention of resistance by the rational use of antibiotics. Without any bias, I want to say that pharmacists are the critical members of this framework because pharmacists validate or confirm prescribing practice and thus have tacit oversight of prescribers. They are strategically placed to educate patients and effect behavior change in terms of patient demand for antibiotics. Pharmacists are critical to the implementation of policy, as well as the generation of evidence to inform policy-related interventions. And finally, pharmacists prevent antibiotic resistance by impacting on prescribing practice, patient behavior, and policy implementation. You will recall from the workshop on the 12th that we decided to focus on 3 of the 5 strategic objectives of the Global Action on Antimicrobial Resistance that resonate most with the policy and practice roles of the pharmacist. These are strategic objectives 1, 3, and 4, and they read as follows: to firstly improve awareness and understanding of AMR through effective communication, education, and training. Secondly, to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures. And thirdly, to optimize the use of antimicrobial medicines. We also highlighted the COM-B model and the focus on education, policy, and public health. We wanted to specifically incorporate the COM-B model because we believe that pharmacists have immense capability, opportunity, and motivation to prevent, contain, and mitigate AMR. Pharmacists have the capability to address AMR because they have the knowledge, skills, and abilities or proficiencies acquired via education and practice. Pharmacists are motivated to prevent, contain, and mitigate antimicrobial resistance and eliminate it as a public health threat. And finally, pharmacists have the opportunity to achieve this by leveraging country commitment to the United Nations Declaration and the Pharmacy Association's commitment to the FIP policy statement on antimicrobial resistance. So here we speak to public health, education, and policy, and we want to emphasize that the initiatives that we propose within the roadmap for pharmacy can take a policy, public health, or educational perspective. So let's start the interactive part of this workshop, and it's question time. The very first question that I have for you is, has your country approved a national action plan on antimicrobial resistance? And you may answer yes, no, or I don't know. For those of you that are interested in AMR, you will know that the World Health Assembly required all countries to actually to develop these national action plans by May 2017. But we know that many countries did not make that timeline. But it'll be interesting to know how many countries in the Southeast Asia region have actually approved a national action plan. We'd like you to cast your votes now, and we will see the results in a little while. So we have 53% of your countries have approved a national action plan, but a number of you don't know whether this is in place already. So I want to really emphasize the importance that the pharmacists have in implementing the National Action Plan, and I'd like you to look into the World Health Organization library of action plans to be able to see whether your country does have one indeed. The next question, also related to the National Action Plan, is for those that answered yes, is the role of pharmacy clearly defined in the plan? So are pharmacists involved in the policy and practice aspects of implementing National Action Plan on antimicrobial resistance? So again, we ask you to cast your vote as yes, no, or I don't know. I must admit that I rarely find pharmacy specifically identified, except when it comes to regulations and implementing regulations relating to the prescription of antibiotics. So I'm hoping that the Southeast Asia region has taken this a little further by looking into pharmacy as a key role player. And the results are similar to the earlier question, about half pharmacists that are identified as implementers of the National Action Plan. Thank you very much for that aspect of it. So if we'll go to the next slide, please, Erin. So this is the table that we want to populate with as many initiatives as possible, after which we will determine the time frames and the people or the officers or the entities that are responsible for implementing these initiatives. It is now my pleasure to hand over to Virat and Manjari to take you through the next session of the workshop. Thank you very much.
Thank you, Dr. Sabiha. Thank you for the kind introduction, and thank you, Dr. Sabiha and Grip, for putting together an excellent and very important session on the antimicrobial resistance. I looked at the poll before, just now, which we had, and I'm not surprised with the results. More than around 50% of the people said that they don't have the national action plan in place. And so around again, 40 to 50% people said that they don't know whether it is there in place. So that exactly tells us why there is so much need to work in this region on the aspects of antimicrobial resistance. Uh, FIP had the survey done few days ago among all across the globe, and we have the survey results over here, the survey insights. I'm very glad to tell you that 559 participants from 99 countries participated in this survey. And so we really have the global insights from this survey. The survey indicated, it is in line with the poll that we had, 47% of respondents were unaware or not actioning about the objectives outlined by the Global Action Plan on Antimicrobial Resistance. And the 5 key barriers which were subsequently identified in this survey insights, that is one important one, the basic one, that is education and training. There is lack of ongoing education and the robust training modules. They're not there, they're lacking on implementing the AMR mitigation strategies for the pharmacy and pharmacy teams in the local setting. And this is causing a big disconnect between the objectives and the operational execution for the responsible use of antibiotics for curbing the antimicrobial resistance. Another key barrier that has been identified from this survey is the lack of financial resources. Despite the national and the global action plans, AMR is not considered as an urgent health agenda by many governments. And consequently, the public expenditure on the AMR mitigation strategy is deprioritized. It is not considered as important, and it is not given the sufficient funding. As you know that many countries have the pharmacy funded by the government. So especially in those countries, this kind of approach leaves the pharmacy with poor institutional support and very little funding to resolve the issue. Another key barrier which is found out is recognition and collaboration. So globally, there is a lack of acknowledgement of pharmacy and its association with the outcomes of the AMR. As such, there is an overestimation of doctors' capabilities in AMR mitigation, resulting in the lack of motivation for collaborations between the pharmacy, doctors, hospitals, academicians, and the policymakers. I feel this is very important point, especially for our region where we see the SCA region, where we see lack or very less collaboration, interprofessional collaboration, and that is giving rise further to AMR issue. Can I have a next slide, please, Erin? So we have two more important insights, the key barriers which are identified from this survey. And one of that is accountability and leadership. There is clear lack of accountability regarding the implementation and monitoring of the AMR strategies that is causing a gap in leadership. So like who is going to be accountable? Who is going to take the lead for the AMR? So this is generating local ambiguities and low level of commitment to furthering the global and the national objectives. And one more insight found out, that is a key and lack of robust policy frameworks for antibiotic prescribing. Many of you will agree with me, many of the colleagues will agree with me that there is no robust policy framework, or there is no policy framework at all in some countries for the antibiotic prescribing, which gives rise to irrational prescribing by the prescribers. So this is a major issue, and that has created a barrier to curbing the inappropriate antibiotic use. Poor encouragement to increase the surveillance, the monitoring from regulatory bodies, again creates the issues with reuse, sharing, and improper disposal of antibiotics among the patients. So these are the 5 key barriers which we found out from the survey, which was for which 99 countries have given their opinions. So as I said, this is very global survey, and we are happy to find out these key barriers and the insights which will lead us to the regional action plans. Can I have the next slide, please? Erin. And now I welcome Dr. Virat to talk more about this survey insights and what different countries felt specifically. So welcome, Dr. Virat.
Thank you, Manjiri. Welcome to everyone. I do agree on the survey that 47% of respondents is unaware and not actioning on objective. And we have 5 key barriers. The first one is education and training. The second one is the financial resource and institutional support. The third one is recognition and collaboration together. The fourth is accountability and leadership. And the fifth, the last one, is regulation and surveillance. For me, I would like to give you more about some comments, some suggestions from this survey. The first one is from Thailand. He commented that there is a very clear lack of resources in Thailand, which results in a lack of implementation and eventually a lack of information for prescribers, pharmacy, and patients. The second comment comes from Bangladesh. We need to encourage academic research among faculties and students to utilize existing capacity to enhance health outcomes. The third one is an idea or comment from Indonesia. From Indonesia, I like to see an integrated and sustainable monitoring method to ensure the implementation will have a significant impact. I think the third comment is about the research and surveillance to monitor and get some data or information to give the impact on from Indonesia. And the fourth one is from Thailand. The pharmacies must be considered as a necessary at a national level. For me, from Thailand experience, as a first commenter, we may lack of resource for some prescriber, pharmacy, and patients, especially in the private sector. But in the government and public sector, we have a lot of progress on AMR. We joined with WHO to set up the National Strategic Plan on AMR in 2017. And this year, we have the second National Forum on AMR in early of February this year. In Thailand, we have a lot of progress on AMR. You can see in the clip video in the YouTube. If you want to see, please you search midterm progress AMR Thailand. You will see the clip video of the midterm progress of the AMR in Thailand. And you can see a lot of progress in Thailand also. Next slide. And this one is from our capacity or education opportunity or policy and public health or motivation. You can see we have like a 3 strategic objectives from the Global Action Plan or AMR. The first one is to improve awareness and understanding of AMR through effective communication, education, and training. The second is to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures. And the third is optimize the use of antimicrobial medication. For these three objectives, we have some suggestion or some ideas or some initiative that to improve awareness and understanding. The first one is to train the pharmacist or pharmacy staff and whole chain through the continuing professional development, or in Thailand we call CPE, continuing pharmacy education. The second is to public awareness campaign for the public by civil society and government to help education and appropriate use of antimicrobial and treatment options. For reduce the incidence of infection, we have a suggested initiative to hospital to follow strict practice for the infection control measure and strict monitoring and authority for the same, just like hygiene, hand washing, and hazard mask or PPE something. And for the hospital, I think it's good to develop IAM or integrated AMR management. This integrated AMR management is like every health care professional that related to infectious disease must to work together, to work and concert to solve this problem. For the third, optimize the use of antimicrobial medicine. We have two initiatives. The first one is to reclassify the antibiotic, the antimicrobial or antimicrobial. We should reclassify oral antibiotic to be dispensed by community pharmacists only, and no allow antibiotic to be the OTC drug. The second initiative is to regulator to enforce existing drug law strictly and reduce the number of the original fixed dose combination of original fixed dose formula in the region or in the country. Next slide. This slide will review again that present to improve awareness. We choose like continuing pharmacy education to improve the pharmacy staff, and other, and to focus AMR and responsible use of antibiotic in pharmacy undergraduate curriculum, like undergraduate curriculum for the pharmacy student and for the medical student. It's a good for give them the right information at the young staff. And the second initiative is a public awareness campaign by the civil society and government body that help to educate and appropriate treatment option. For example, Thailand have a campaign that you will see next.
So before we go to that video, Virat, can we please the polling for the first initiative on training and practicing pharmacists, and the
Oh, good. When when put it,
First initiative that has been recommended by the Southeast Asia region. Please, can we ask all of the participants to vote? By when do you think that this can be achieved in your region? Some of the countries may already have this implemented in an advanced stage, while other countries might be at the inception phase. So would this be achievable by 2021 or 2024? Over to you, Virat.
yes. And for Thailand, we implement already about 5 years ago. Yes.
So perhaps
Wow.
you or Manjri can comment on the results.
Yes.
Yes. So
45. Yes, that's Manjili.
Virat, yeah, thank you.
Yeah,
So
thank you.
the results of the first initiative, I mean the polling, pharmacy staff and pharmacy supply chain training through the continuing professional development programs. So our colleagues opine that by 2021, 45% of the colleagues say that they would like to implement this by 2021. And this is extremely encouraging because that's what is needed in these countries. By 2022, 23% of the people think that they would be able to implement this initiative. 13% say that by 2023, and 20% of the colleagues say that by 2024 onwards, they will be able to implement this initiative in their own countries. So thank you all for quick polling, and thank you all for your answers. Very interesting. Thank you, Virat.
Yes. For in Thailand, we have like we call it different. We call CPE credit.
Yes.
For Thai pharmacists, we must gain like 1,000 CPE credit for 5 years. Yes, I think it's a good.
Definitely.
Yeah.
Are we going to the, Erin, are we going to the video for the public awareness campaign, the video from Thailand? This is a very interesting video from Thailand, the public awareness campaign about the antimicrobial resistance. So please enjoy it. Can we have the sound? So this is really very different and out of the box thinking to create the public awareness. I think there was no clear sound for this YouTube video, but we will like to copy paste this link again in the chat. So all of you can have a look at this YouTube link again after the session is over. So thank you, Virat. Thank you very much for focusing on the first two initiatives.
Can we poll, Manjri, can I ask that we do the poll for this next one on public awareness? Then you can take over. Thank you.
So now we go for the second poll. By when could this initiative be implemented in your country? We are talking about the second suggested initiative, that is public awareness campaigns by the civil society and the government bodies on appropriate treatments, or in general about the antibiotic usage. So you get 30 seconds, all the colleagues, to vote. So please submit your polls. Okay, so 61% of the participants think that they will be implementing this from by 2021. I'm sure some of the countries already have their campaigns in place, but maybe they are running sporadically. So they may would like to enhance that and take it to the higher level. So 2021, 61% say, 22% of the colleagues say that by 2022, so 2 years from now, they would like to implement this initiative or strengthen the existing initiative. 5% say that and 12% by 2024 onwards, they will be implementing this initiative or strengthening the already taken initiative in their own countries. So thank you again, colleagues, for quick polling. Thank you so much. So as we finish with the second initiative, discussion about the second initiative, we go to the next and third initiative. Can I have the slide, please, Erin? And that is yes. So this is, we are focusing here on the reduction of the incidence of infection. So infection control and infection prevention measures which are to be taken in the hospital through the effective sanitation, hygiene, and infection prevention strategies. So hospitals, and as you are all aware and you will acknowledge that there has been always, can we have the poll of in a minute, Carola? So you will acknowledge that the hospitals need to follow the strict practices for the infection control measures, and strict monitoring by authorities is needed. You have heard about the resistant bugs, resistant microbes coming up from the ICUs in particular, and in general also from the hospital, from everywhere. We need to have the strict practices and we need to declare the hospital-acquired infections. As you know, we also call it as nosocomial infections to be. This will help for surveillance and reporting of every case of the hospital-acquired infections that we see. So this is again a very important suggestion.
I'm sorry, we seem to have lost Manjari. Virat, can you fill in which poll are we working on?
What the poll going on? Yes. Sorry for mentally. I think it's yes. By when could this initiative be implemented in your country? Monitoring of hospitals to ensure infection control measures are followed. Let every participant voting. It may be 221 or 222, 223 or 224 onward. It's voting.
So just to say that infection prevention and control is generally a separate program that is implemented in mostly healthcare facilities. And the aligned aspect is the water sanitation and hygiene in the community setting. So when we think about, when you answer these questions, think about, this is more for the hospital pharmacists, think about whether you have an IPC nurse or isolation wards, etc., within your healthcare facility. Thank you, and we'll wait for the results.
Wow.
This is expected because IPC was in operation far earlier than AMR got to the forefront of the health agenda. So we do expect this to have high results. So 67% probably already have it in place and just need to improve it. And others will slowly, incrementally do that. Great. So continue, please. I don't know whether Manjri's joined us again, or if not, if you can continue, Virat.
Yes.
Manjri, are you-
Sabiha,
Yeah, oh, good.
can you hear me?
Yes, we can. Please go ahead.
Yes, thank you.
Yes.
Thank you, Virat. Yes, I just had some connectivity issues and I apologize for it. So the next suggested initiative that we have is again an important one and focusing mainly on the hospital setup. And that is developing the integrated AMR management in the hospitals. We acknowledge that there is lack of interprofessional communication and collaboration. And that's what exactly is focused in this suggested initiatives, to have the interprofessional collaboration between the medical doctors, the nurses, the pharmacists, the microbiologists, the pathologists. So all come together and they will be making the strategy and implementing that strategy in the hospitals to follow the strict infection control measures as well as the antibiotic surveillance. So again, this is an important suggested initiative. We would like to have a quick poll on this initiative, whether you would like to implement it by 21 or 22 or 23 or later. So can we have the poll, please? So when could this initiative be implemented in your country? That is the integrated antimicrobial resistance management. You can get 30 seconds.
Wow.
All right. So this is again in line with the 65% of the colleagues would like
65.4% is for the 221.
6.4% 2024 onwards. So thank you for the quick poll, encouraging results. We're very happy to see 65% of the colleagues would like to implement this initiative in hospitals by 2021. Thank you. Yes. So going forward to use of the microbial medicines, and this is in an important area. Suggested initiative that suggests that reclassifying the oral antibiotics to be dispensed by community pharmacists only, no OTC antibiotics. And no, in many countries, antibiotics are only prescription medicines and at all available through the community pharmacies without prescription. But in some countries, there is a regulation that the pharmacies can dispense it. Suggests that should be reclassification of oral antibiotics, which be dispensed only by community pharmacists. It should not be any OTC antibiotics when without prescription. And in countries like India, we see a rampant practice self-medication of antibiotics. And we see also the sale of prescription antibiotics. I mean, all antibiotics are prescription medicines in India, and they're still without prescription. There needs to need to look at this area, and we need to hold suggestion from all the leagues over here. So this is one important suggested initiative, that we need to have antibiotics dispensed only with the prescription or poll on this initiative, please. So this initiative, you need to answer the poll, reclassify the oral antibiotics to ensure there are no OTC dispensing and replace with symptomatic relief treatments based on the evidence. So again, you get 30 seconds for the
To reclassify this antimicrobial oral dosage form.
Okay.
Okay, 55.7% is in next year, and 17.1% for the next.
12.9% by 23, and the remaining.
I think it's a good that we not allow OTC antimicrobial dispensing. It will reduce
Yes.
the use
So
of.
the next.
Yeah.
Hello.
I see you. I heard you, but the sound is not so good.
Thank you very much. I think maybe we should just switch off our videos so it will improve the
Okay.
connectivity. Thank you.
Yes, please go ahead.
Okay, so that concluded the questions related to by when we should be able to achieve these objectives. We have a list of a number of objectives that both Virat and Manjari spoke to and explained. Can I ask the attendees to please identify which of the 3 initiatives you feel will be most impactful in your country? So please tick on 3 of the ones that you think would be most beneficial in addressing antimicrobial resistance in your countries. You may vote now. And we do realize that we may not have captured every single initiative and that the attendees may have really good ideas. So please can we ask you to write either in the chat or in the Q&A box some of the other initiatives that can be implemented in your countries. So we are on with our poll and we're looking to see which are the most popular ones and which are the ones that will have the most impact in preventing, containing, and mitigating AMR in your particular country. And the winners are... Okay, so there's lots of importance placed on supply chain management and how to ensure access, right from access to, I presume, pharmacovigilance and disposal, using CPD programs. Public awareness is also very high on the agenda. And I presume that we all are aware of the World Antibiotic Awareness Week in November. And this is an ideal time for us to really engage with the public awareness campaigns. Antimicrobial resistance mitigation requires the whole of society engagement. So it's from the bottom up, general public upwards, and from the top down, which is the governments. And then finally, we're looking at an AMR sensitive issue in terms of infection prevention and control. So if we prevent the spread of infections, we automatically reduce the number of or the amount of antibiotics that are required, and therefore the selection pressure for the evolution or the escalation of resistance. So thank you very much. And it was also good to notice that the infection control implementation was further along than the AMR implementation in many of the countries from your responses. So that was really great. I'm going to ask Virat and Manjari to perhaps give us an overview or a summary, and then I'm going to go into questions and answers. Thank you.
So if you can, I'm back again. I'm sorry for the technical issues. So as we can see, there are 3 key action areas: the education, policy, and public health, and strategic objectives, that is improving the awareness and understanding of AMR through the effective communication, education, and training, reduce the incidence of infection by infection control and infection prevention measures, and on the optimal use of antimicrobial medicines. So for this, the suggested initiatives that we have put together, as we have just walked through it and we have discussed about it, but just revising it or summarizing it, is training of the pharmacist and the entire supply chain through the CPD. Public awareness campaigns by the professional associations, other civil society bodies, as well as the government, to create an appropriate treatment, to educate the masses on the appropriate treatment options. Hospitals to follow the strict practices for the infection control measures and strict monitoring by the authorities. Developing integrated AMR management in the hospitals. Reclassifying the oral antibiotics, which could be only dispensed by the community pharmacists, and no self-medication of antibiotics, no availability of antibiotics anywhere else than the pharmacies, and replace this with evidence-based symptomatic relief. Regulators to enforce the existing drug laws strictly. So this is something that we couldn't get an opportunity to discuss before. So in many countries, the regulations are in place that the antibiotics are prescription medicines and they should not be dispensed without a prescription. But it doesn't happen so, and many times antibiotics are dispensed without a prescription, or the records of the antibiotic sale as required by the regulation is not met. So these regulations, whatever the drug laws are, they shouldn't be just remaining on the paper, but they should be enforced very strictly. Also, in some regions, in some countries, in some parts of the countries, we see that there is no registered pharmacist present in the shops, in the pharmacies. So the sale of medicine happens without the pharmacist. So there is a regulation that the pharmacist should be there all the time present for open hours of the pharmacies. So such regulation should be strictly enforced, which will help to improve the pharmacy practice. Not only that, but it will help to reduce the AMR. It will help for rational use of antibiotics. Also, in some countries, we see large number of FDCs, the fixed dose combination. Unfortunately, many of them are irrational. They're not of any scientific therapeutic value, not shown, not proved, as well as it makes the formulation very expensive by combining various ingredients irrationally. So even this needs to be looked upon. And so there has to be regulation in place, policy and implementation to curb the irrational FDCs of antibiotics. There needs to be more awareness about this among the pharmacy teams and all the stakeholders. So these are, let's say, the suggested initiatives that we have put together, but I'm sure all the colleagues who are attending this session, they may have something else in mind. There might be some other campaigns, some other initiatives which are already taken in the other countries, and maybe, or you would like to suggest some. So I request you to put your thoughts, your ideas in the Q&A box, in the chat box or in the Q&A, which will help us to formulate a robust roadmap for our region. So requesting all of you to put your ideas, your thoughts, or any more of your concerns in the chat box now. Thank you so much.
Thank you very much, Manjari and Virat, and thank you for giving us an overview of all of the initiatives and how things can be advanced within your region. There haven't been too many questions or queries within the chat box or the Q&A, but there has been quite a bit of concern raised around continuous professional education, the CPD, and the fact that a number of CPD courses are quite expensive. So we've got Mr. John Bell from GRIP answering and giving a few ideas in terms of where funding, that a number of free MOOCs as well as CPD courses, and we will certainly take this up as the FIP AMR forum going forward as well. But Manjari and Virat, would you like to speak to the importance of CPD and particularly the costs of CPD going forward? Please go ahead.
Yes. May I talk? In Thailand, we support CPD for every pharmacist for free. Yes, normally we have two types of CPD. The first one is like a symposium. If you go in on site, when you listen or involve in the symposium, you can get CPE credit. This is the first one. The second one is like an article that's public or on the internet, on the website, that every pharmacist can learn it on online, and you can earn the internet easily. All of these are free for the Thai pharmacist. I think it's a good idea. If FIP will provide, it's the same. For the example, this section that we meeting and this meeting for 1 hour. For Thai pharmacists, they will gain 1 CPE credit if they listen this section and take some question after finish this section. Is for CPE from Thailand that we want to share with the other. Thank you.
Okay, great. That's a great thought,
Yeah.
Vera. And I would like to comment that in country like India, the continuing professional development programs have been made mandatory, but there is no much clarity and there is no yet proper implementation of the CPD programs for the pharmacists. There have been the program, I mean, and I feel it is a need of the hour to have very robust and focused CPD programs for the pharmacist on AMR, because our education also does not adequately prepare the pharmacists regarding the antibiotic responsible use and the AMR. So CPD becomes all the more important. Dr. Sabiha, now recently, because of the COVID, the webinars have become very popular. And this digital mode of CPD is picking up very much fast, very rapidly in this region and everywhere in the globe. And FIP had several webinars, as we know. So I have a hope that through this digital mode, we will be able to have the CPD program, CPD focused on AMR on a consistent basis. So I see some hope, and I also appeal to all the pharmacists to have a look at the FIP website and look at the role of pharmacist in AMR, the policy statement which is developed by the FIP. So that is very valuable resource, and you would like to download that. So there are various ways of CPD, not only the face-to-face programs or the digital webinars, but there are many resource materials. Thank you, Sabiha.
Thank you very much. So we've got one question around partnerships or interrelationships or interprofessional collaboration between prescribers and dispensers, so the pharmacists and the doctors, and how these relationships can be leveraged for antibiotic stewardship. That's the first question. And the second question, and the last question that we have time for, speaks to reserving certain antibiotics for use for certain infections. And I want to just ask that you comment on the new AWARE categorization by the WHO, where we have access, reserve, access, watch, and reserve antibiotics. So two questions, and then the use of antibiotics according to the AWARE categorization of the WHO EML. And then I will take over to summarize the events and speak to next steps. So thank you very much, Manjari and Virat, one after the other, please.
Yes.
So the interprofessional collaboration is extremely important. And we see in this part of the world, we see that the pharmacists are not respected as much as in the developed world. And so there has to be a collaboration. Unless we have the cooperation and the collaboration and the trust, we cannot move forward in this AMR map. So that's a very important question or important concern that has been raised by our colleague. And secondly, regarding Virat, would you like to comment on this?
For the interprofessional collaboration in Thailand, we work together as a team, especially in the hospital. In the hospital, pharmacists and doctor and nurse and infectious disease specialists work together to infection control in the hospital. It's a good result. The resistant strain or the use of antibiotic in the hospital is sustainable, reduced continuously. And for the second issue is like a reclassification of antimicrobials. In Thailand, we start to reserve some important important antimicrobials such as colistin or polymyxin. In Thailand, we withdraw all of the medicine registration of this medicine from the community pharmacy, and let it use in the hospital only. And also we listing the use of anti-tuberculosis or anti-TB, such as rifampicin, to use in the hospital only. And also we stop to use oral antibiotic for OTC, and let the community pharmacists prescribe or dispense this medicine. Let
Right.
Manjiri go on.
Yes. So thank you, Virat. I think that is very thoughtful,
Yeah.
and the good policies you have you're already implementing in Thailand. And regarding the second point that Dr. Sabiha raised, that is the reclassification of antibiotics or precisely reserving some antibiotics. I think that is very much needed, and there should be strict standard treatment guidelines, standard clinical practice guidelines for the medical professionals. And some of the antibiotics, the high-end antibiotics, they need to be kept reserved so that they are not misused, they are not overused, and so we save them for the resistant infections. So Dr. Sabiha, before you go for the summary or summarizing the session, one of the points which is raised by some of our colleagues is the political goodwill to have the AMR map and to have the AMR action plan. So that is very, very important, that unless political goodwill is there and the support is there, it is very difficult to make the policy or implement it in an effective way. Thank you, Dr. Sabiha. Dr. Sabiha?
Yes, I'm back. Sorry.
Yes.
Yes, I can't emphasize or can't agree with you more when it comes to the importance of political will and the political support as we go forward in implementing the roadmap or the national action plan. You are so right, Manjari, that becomes very important. I do realize that some people have had their hands up. Unfortunately, time doesn't allow us to allow further inputs, but I'm going to quickly go, first of all, to thank Manjari and Virat for all of their facilitation, and then just to go through very quickly the next steps. So if those of you that attended the session on the 12th, you'll remember that the CEO of FIP, Catherine Duggan, spoke about the FIP AMR Commission and made mention of the FIP development goal related to AMR on that day. And both of these are going to be launched on the week of the 21st of September, both the development goal as well as the launch of the AMR Commission. And the first output or the first deliverable of the commission will be the regional and global roadmaps for pharmacy. So we ask that you watch this space and please continue to engage with us as we roll this initiative out. So just to continue with the next steps, we have identified key actions and engendered regional commitments to AMR action in pharmacy. The roadmap is designed to be an iterative tool that will act as a compass to guide actions globally, hopefully sustaining momentum and evaluating progress in pharmacy. And then it will be revised annually. It's a living document, culminating in a presentation at the FIP World Congress in 2023, where we hope to hold a special health ministers summit. So we look forward again, and we really encourage your continuous engagement with the roadmap, and we really count on you to implement all of these initiatives in your countries and your regions. And my very last slide is to acknowledge all of the people who made these sessions, both the global and the regional sessions, possible. Catherine Duggan, the CEO of FIP, for advancing the AMR and antimicrobial stewardship discourses within FIP. Adrian Shepherd for his visionary leadership of GRIP, and then Jane, Erin, and Ashlyn from Cello Health, and Carola and Susanna from FIP for your invaluable support. And thank you again to Virat and Manjari, and a very, very special thank you to all of you who made the time available to attend this regional workshop. Please, we encourage you to come up with further initiatives as the roadmap evolves, and we will be communicating with you after this event to ensure that we keep you engaged and that you can input on these initiatives. Thank you very much, everybody. I wish you a good afternoon and an evening. Goodbye.
Thank you.
Thank you.